tutorial on how new employees for Alliant Consulting can review and enroll in the employee benefits that are available through the plan year September 1st, 2024 through August 31st, 2025. My name is Bill Hammond. I'm proud to be your insurance broker. Along with my team, there are two dedicated people to your account, Anna Novaez, who is an account manager, and Araceli Velasquez, who is our customer success representative. Araceli will be helpful with all the technology, finding doctors, helping you with the enrollment process. Anna can help you understand what is best for you, how to understand the different plans, and trouble enrolling. And if there's anything really important, anything you want my expertise on, I am always available. There's my phone number and my email address. We'd love to speak with you. Quick agenda of what we're going to talk about here today. We'll talk about the employee benefit offering, the medical, dental, vision plans, do a quick tutorial on how you're going to enroll, and where do you go with questions. So here is what Alliant Consulting offers employee benefits, the rules and the timeline. So Alliant Consulting pays 75% of the employee-only cost for the Anthem Blue Cross Silver Priority Select HMO. If you choose a different plan other than that Silver Priority Select HMO, you'll be able to use those funds to apply towards a different plan. So even if you don't choose that plan, you still get the full contribution from the company. Company pays also 75% of the United Healthcare Dental HMO plan and 75% of the employee-only cost for the United Healthcare Vision plan. The company pays 100% for $25,000 in life insurance through Unum. And they also pay 100% of the cost for an employee assistance plan through Unum, which we'll talk about all of those momentarily. There's a waiting period, meaning after you join our employment, you have to wait a certain amount of time for Alliant. That is the first of the month following 2 months from date of hire. I'll show you a graphic so you can make sure you understand exactly what your effective date would be there. The enrollment portal, which you will be visiting after this to enroll in benefits, waive benefits, understand the prices, the benefits, compare, contrast, whatever it may be. This is the ease portal you will use. You should have already received an email from the Alliant Consulting Incorporated Benefits Management team. Please complete this enrollment within 2 weeks of receiving this email. So here's kind of your waiting period explained. Let's say that you have a hire date of February 10th. We look at first of the month following 2 months. So we're hired on February 10th. 1 month is March 10th. 2 months is April 10th. And we look forward to the next first of the month, which is May 1st. So February hire date would be a May 1st effective date. Same thing if it was a January hire date, you'd be an April 1st effective date. You can see the calendar here. You just take your hire date, you go to the next month, second month, and then the first of the month following that second month is your effective date. If you are going to enroll and need to disenroll later, if you are going to waive coverage now, but you want to enroll later, you will need to have a qualifying event, qualifying life event. So these, the list on the screen here are the most popular ones, the most consistent ones we see. Usually what we'll see a lot of times is someone that does not need this coverage because they have coverage to their spouse, but then they get divorced or that spouse loses their employer-sponsored insurance. If that were to happen through the middle of the year, you would be allowed to jump back onto our policy. Same thing goes where you might take this policy and halfway through the year you get married and your new spouse's policy is a better option than what we offer here. If that's the case, it's a qualifying life event for you to leave the policy. And then there are a number of people at Alliant who are younger and maybe under the age of 26 that might have their parents' plan. Well, once you turn 26, you will be kicked off of that plan, and the first of the month following your birth date. So let's say you had a March 18th birthday, you would be off the plan as of March 31st and enrolling in the Alliant plan as of April 1st. Okay. So this is just to say for those of you that are deciding to waive this coverage because you don't need it or don't want it, if that changes because you lose coverage involuntarily someplace else, you would be able to join this plan in the middle of the year. We have 6 plans for medical plans available from Anthem Blue Cross. We have 2 gold plans, 2 silver HMO plans. So these are the 4 HMO plans. And then we have 2 PPO plans, 1 gold, 1 silver. Now, these 2 gold plans are identical in every single way except the network of providers. So when you see the word select, Sharp doctors. So this is for the San Diego County folks. When you see the words priority select, this means Scripps doctors. So these are different network of providers. So think to yourself right off the bat, do I like Sharp? Do I like Scripps? Here's some more information on the different medical groups that are in the select versus priority select medical groups. This is not all of the list of providers, but these are the most popular ones. So this is who you're looking for if you're looking for UC San Diego or Graybill or Sharpie Steely, you want the select. If you want Scripps Clinic, Scripps Coastal, you want the priority select. So here we see our HMO plans. Now there's 2 silver and 2 gold. I've got them listed as one here because the benefits are identical. Both silver plans have the exact same benefits. It's just a matter of of the medical groups you want to go with. So our silver plans here have a $2,500 deductible are $0 deductible. So let me walk you through some of this terminology so you feel comfortable with the decisions you make. We'll start at the top here with the deductible. A deductible is the number that the insurance company says you must pay all of this number before we start to pay anything. So for your silver plan, that's a $2,500 deductible, meaning that you're out of the pocket a lot up front should you have some expensive claims. Now, notice wherever you see the term DED waived, this is deductible waived, it means you do not have to pay that deductible. So for an office visit on the silver plan, it's $60 for a regular primary care physician, and it's $95 for a specialist, deductible waived. If I need blood work, so that's a diagnostic lab, $20 deductible waived. If I need x-ray, that's going to be $0 or $20, depending on where you're at, deductible waived. All right. Imaging, CAT scan, PET scan, MRI. If you're in an office or a freestanding facility, it's $200 deductible waived. Physical therapy, occupational therapy, speech therapy, $60 deductible, $15 deductible waived. And all the way down here at the bottom, urgent care, $60 deductible waived. I'm pointing all of that out for those of you who don't have a lot of needs for your healthcare services. You haven't been to the doctor or the hospital very much. These silver plans are a really good value, especially when you consider that this deductible here is scary at $2,500, but regular doctor visits, specialist, x-ray, lab, MRIs, physical therapy, chiro, generic drugs, and urgent care are all a copay before you meet the deductible. So that should be comforting. That means if you have a regular kind of quote unquote normal year, you're not going to touch that deductible at all. Now below the deductible, we see this out-of-pocket maximum. It's a much higher number. So this is the number at which if once you spend this much money out of your pocket, $9,100, then you pay $0 for the rest of the calendar year, and Anthem Blue Cross pays 100%. All right. So you might be thinking, well, what's the difference between a deductible and an out-of-pocket? Well, I'll explain it to you with an example. So let's say that I'm on this plan here and I have a major hospital stay, $100,000, 7 nights in the hospital. That bill would break down like this. I would be asked to pay 100% of the costs for the first $2,500. After which, now we're looking down here at hospital services, after which I pay 45% of the cost. Blue Cross pays 55% of the cost until my 45% plus my $2,500 equals $9,100. Once I hit that $9,100, Anthem Blue Cross is paying the other $90,000, $90,900. So a lot of what you're paying for in a health insurance premium is this deal you make that says at this particular number, I pay nothing else for the rest of the year and you pay everything else. So the difference between deductible and out-of-pocket max, the deductible is the amount you pay 100% of. And then you have all these copays, all these different things, $70 for drugs and $60 for urgent care and 45% for hospital emergency room. That is, you're paying those amounts after the deductible up to this 9,100, at which point you pay nothing. Once you hit this number, you don't pay for doctor visits, x-rays, labs, prescriptions, surgeries, emergency rooms, urgent care, nothing. Now notice how this gold plan contrasts that in a pretty major way. We have a $0 deductible, so we're never out of pocket 100%. We have a $6,750 maximum out of pocket, much lower. Our doctor visit copays are lower. X-rays and labs are lower. MRIs are lower. There's no brand name drug deductible here. And then the biggest difference is hospital stay, surgery, emergency room is a flat dollar copay. So remember we said $100,000 problem over here would cost all $9,100. Over here, I'm paying $750 a day for 4 days max. So that's 7 days in the hospital that I had in that example would cost $3,000. All right. If I had a surgery during that time, it'd be $550. If I started that whole thing out in the emergency room, it'd be $325. So you add all those up, and that would be my out-of-pocket costs. So you see with the gold plan, your expenses in the major situations are managed much, much better. There's far less out of your pocket when you have a major event. So if you're someone that has a surgery coming up, you have lots of MRIs you need to get, you're having a baby, whatever it may be, you should definitely be looking towards these gold HMO plans because while they will cost you more out of your paycheck, they will save you a lot of money out of pocket when you are at your healthcare provider. Let's talk a little bit about prescription drugs. So you see on this plan here, we've got a deductible of 200/400. So this 200 is your brand name drug deductible. So anything in after tier 2, 3, and 4, you're going to pay the first $200 of it, and then you get these copays. All right. Tier 4 is not on here just to save space. These are the self-injectable drugs. These are the chemotherapy drugs. These are the really heavy duty drugs. So you would pay the first 200 and then you get these copays. Again, all of these numbers we're talking about are accumulating towards this maximum out of pocket. So if you somehow had several hundred or even a couple $1,000s of expenses prior to having that 7 day, $100,000 hospital stay, everything you had already spent you would already be at that level. So you total cumulatively on the year would spend no more than 9,100. Back down to our prescription drugs, they list them in different tiers. So tier 1 are generic. Tier 2 is your preferred brand name drugs. Tier 3 is your non-preferred brand name drugs. Tier 4, which is not listed, is again, these are the self-injectable drugs. These are the diabetes and cancer drugs. These are the Ozempic and those type of drugs. Those will all be a lot more out of your pocket. And then they also have different levels of pharmacy. We're going to get to this in a moment, but they have level 1 pharmacies where they've got a better deal worked out with these pharmacies. So they pass along that savings to you. And then they have all the rest of the pharmacies at level 2. We have a slide in a moment that will talk about that. Last thing to talk about is these family numbers here. For those of you that are enrolling all by yourself with no dependents, no spouse, no kids, these second numbers don't mean a thing in the world to you. For those of you that are enrolling with a spouse, with a child, with a spouse and child or children, your $2,500 deductible turns into a $5,000. Your $9,100 out-of-pocket maximum turns into $18,200. However, this term embedded is very important. This term embedded means that there are really two $2,500 deductibles loaded in here. Meaning if I'm having that 7 day, $100,000 problem like we talked about a moment ago, and it's me, my wife, and our 3 kids on this plan, I will have met my deductible in full at $2,500, and then I pay my 45% until I hit $9,100, at which I will have paid my maximum amount of pocket as an individual in full, and all of my services for the rest of the calendar year are covered 100%, and my family has the other $2,500 deductible and the other $9,100. So this term embedded is very important, and it's there to protect you as the consumer so that if one of you in the family unit has a major expensive year, you're not paying any more than the individual cost that you would pay if you were on the plan alone. Here's our PPO plans. We've got our silver and gold. You'll see a lot of the same differences, higher deductible, zero deductible, a little higher out of pocket, a little lower out of pocket, lower copays from the gold plan than the silver. Okay, all the way through, the gold plan is going to be a better plan. The gold plan is a more expensive plan. The gold PPO plan is great for those of you that have a lot of healthcare needs and you want a lot of choice. You don't want to be told where to go and made to wait weeks and weeks on end. PPO plans are going to give you a much better experience. You'll have far less time waiting for providers with a PPO plan, but you're going to pay for it. The silver PPO, great for those of you that might really value that freedom of movement through the different health plans, but are not overly concerned with having the deductible because you don't use a lot of healthcare right now. Here's this flyer we talked about, level one pharmacies versus level two. So CVS, Walmart, Albertsons, Safeway. This is what you want to be thinking about. CVS, Walmart, Albertsons, Safeway. Those are our level one providers, prescription drug providers. And level two, Walgreens, Rite Aid, Costco. Okay, these are big names. Lots of us go to them. These are going to be our level two providers that are going to ask us to pay a little bit more for those prescription drugs. Here's a little promotion for Sydney Health mobile app. The mobile app for Anthem Blue Cross is called Sydney Health. This is what you want to download. The single most important thing you can do to improve your healthcare experience is to download this app. You can talk to doctors, you can look up prescription drugs, you can file a claim, review claims, you can see your benefits, you can find doctors, all kinds of stuff. Really, really, really helpful stuff. Now let's talk a little bit about how we find a doctor, because of course, if you're choosing an HMO plan, it's going to ask you to choose a primary care physician. You do not have to do this. You can elect not to do this. But if you want to make sure you get your provider, this is how you would do it. You go to anthem.com/CA, hit the Find Care button. Once you get here, you're going to scroll down a little bit and you'll see you can search as a guest. This is what you want to do because you're not a member yet. You don't have ID numbers. You're going to choose the medical plan that's from this drop down, California, employer sponsored. And then again, if you want Scripps doctors, you're going to select priority select. If you want the PPO plan, you'll select PPO. If you want Sharp doctors, you'll select the select plan. Once you do that, you'll get here and you can put a number, you can put your zip code, you can look for your doctor specifically, you can click on primary care. Just a quick note, always know where your nearest urgent care facilities are. Urgent care visits are a copay, whereas emergency rooms are the most expensive ways to access care in America. So always important to know where your nearest urgent care facilities are. So we looked that up. We found our doctor, Dr. Colin Teghue. They're at a couple of different locations. And what you're looking for is this PCP ID number. So if you want to go to the Sharp Community Medical Group, you go OHP 337. If you want to see this person in the Prospect Medical Group, you would put 41T081. These are the codes I'll show you when we do a quick walkthrough of the Ease portal shortly. These are the codes you're going to put in there along with the name of the provider. Again, another plug for our Sydney app. The best way you can improve your experience is to download this app. It's called Sydney. Make sure you do that. Dental plans. We've got one HMO plan. HMO dental plans are great because they're low cost. They don't they manage your expenses out of pocket at the dentist's office very, very well. Everything's a copay. There's no annual maximum, but the drawback is there's not nearly as many providers. So for those of you that just want a couple of free cleanings, the dental HMO is the way to go. For those of you who have a lot of work that you need done, or you have a lot of preference on who you see, the PPO plans are going to be a better option for you. All right, so here's our one PPO plan. The benefits of a PPO plan, tons more choice of providers you can see, lots of flexibility, much better experience when you're accessing care, but you're going to pay more out of pocket. How do we find a HMO or PPO dentist? We're going to kind of go through the HMO part specifically, but either one, you go to My UHC and find a dentist. Once you do that, you would go into the system and you would look for your provider and you would find their PCP ID number, same thing, same way we did with our medical plan. Vision benefits, good plan here. Once every 12 months, you have a $10 copay for an eye exam. Once every 12 months, you have a $25 copay for lenses. And once every 12 months, you have a $130 retail allowance for frames. So if you need a vision plan, this is a good one. If you don't, you're welcome to completely waive this coverage. Again, here's how we find the provider. This is kind of back. It was a little out of order. I apologize for that, but this is how we select a primary dentist. Once we click this find a dentist button here, you're going to choose the employer and individual plans. I put in my location and I'm looking for the CADHMO plan. That is the name of your HMO network. You'll search through there, same way we did before, and you'll find this provider or whatever part of you like. And over here on the right, this is the provider ID number you're looking for. That was how you would enter that into the enrollment portal. Unum provides us with our $25,000 in life insurance. Thanks to your employer for paying for that. They also pay 100% for this employee assistance program or EAP program. Really great place to start a healthcare, mental health journey. Sometimes these providers are difficult to get into, and sometimes the needs we have are more immediate. This is a great place to start. You call the number down here on the right, you tell them who you are, and they can help you with stress, depression, anxiety, relationship issues, anger, grief, work-life balance, alcohol abuse, family and parenting problems, elder care, lots of different things. Identity theft and financial services, lots of really great ways to start any challenging part of your life. This is a really great place to start, and it's outside of your employment. It's completely confidential, and they are a great resource. So let's talk real quick about logging into Ease. So let me do this real quick and get you into your Ease real quick. I'll be right back as I get in here. So with the Ease portal, we are going to spend some time going through here, and we are going to learn how to enroll in our plans as soon as I can get us there. So here we are. We are in our login site. For those of you who have never logged into this, you will be asked right off the bat to create a username and password. Once you create the username and password, you're going to go right in here. You're going to hit open enrollment. You start enrollment. You hit start here. This video here. So you'll probably see that video here once you go through here. Continue. And you load in all of your information here. There's a lot of asterisks there that are very important for you to fill out. Continue. Add your dependents. Adding your dependents here does not enroll them in anything. Rather, it just lets you have them here so you can see if you want to add them or not. Most of you do not have Medicare. You'll just hit continue through there. And then we get to our medical plans. Very important. You don't skip past this. See how it says you have to select the check mark to enroll or the X to waive. And if I don't check anything, there's nothing for me to select down here. But if I hit this green button, notice all these buttons show up. Okay, so very important to do this. I'm going to waive my kid because they have, we'll say they have Medi-Cal, and then I can say this, if you have the right information here, you want to put it in there. If you do not, you can put some dummy information in there, but we always would prefer to have the right information. And here we see all the different plans and how much they would cost on a per pay period basis. I can click any one of these documents here and open up and see a lot more details on these plans. I can click here to search for the provider like we talked about. Okay. Here's that basic search as a guest as we looked at before. I can figure out how to download an ID card. Here's the mobile app flyer, summary of benefits and coverage. This is a required document for you to open. You got to open it per Obamacare. And then here's that Anthem Network Pharmacy we talked about here that talks about level 1 versus level 2. So I'll select this plan here. And all the way down here at the bottom, it's going to make me pick a PCP ID number or name. We went through that tutorial a moment ago. You can do that, or you can hit auto assign. If you hit auto assign, you'll be able to change this later on. You will be able to change this through Anthem Blue Cross directly later on if you'd like. I'll enroll everybody in the HMO dental plan. Again, links are here. I'm going to auto assign my dentist because I know I can change this later, or if I really wanted to choose it, I can do it now. Let's enroll everybody in vision here. Select, there's the links there. My $25,000 in life insurance coverage is selected automatically. Continue. Here's the EAP. It's all going to be automatically enrolled. Just choose everybody, zero cost. But my spouse is my 100% beneficiary. I can do my child as secondary. So if me and my spouse both were to perish at the same time, the secondary beneficiary is that would be the person remaining. So here's all the choices I made and how much it's going to cost me on a per paycheck basis. I can print this summary here if I wanted to, or if I just want to keep it going, I just hit continue, sign forms. Now this really just turns into basically a DocuSign type of scenario. I'm sure you guys have all been through this. So we type our name and then we use our mouse to find it like that. Next. And then I just click all the way through here. It puts all of my signatures in all the right places. Finish, finish, and I'm all done. All right. So now it says manage enrollment and I'm all set. So I don't need to do that any longer. So we will turn, let's get back to where we finished up. Sorry about that, guys. So that's how we enroll. That's your tutorial. You're looking for this email right here. You're going to click the login button like we talked about. It'll take you here. It'll tell you to set up a password and confirm. Again, like we showed you, start enrollment, start, and we went through the rest of the tutorial there. So next step, you're going to want to be looking for this email. You have 2 weeks from the receiving this email to complete it and submit it in. If you have any questions, if you need any answers, we'd be happy to help you. Thank you so much for spending the time with us here today. It's an honor to be your broker, and we look forward to serving you.